Welcome back. This week is Black Maternal Health Week. It's a time to highlight the increased risk that Black women face during both pregnancy and postpartum. To learn more about the warning signs and how to lower the risks, we are joined this morning by Dr. Neeoma Ojiaku. Thank you so much for being here. We appreciate it.
Thank you for having me.
Of course.
Thank you.
Explain why marking this week is so important.
Yeah, so we've recognized over time that Black women tend to have an increase in adverse outcomes during pregnancy. So we already know that Black women are 3 to 4 times more likely to die from pregnancy. And most of those deaths are actually preventable. So this is an opportunity to highlight those disparities and to address them as a society, to bring them to the forefront, to make them to recognize some of these issues.
You talked about that data that Black women are more likely to die during pregnancy. Why is that? What does the data show about the reasons for that?
So there are a number of things that contribute to these health disparities. One is that when we think about race and health, it's not necessarily race, it's racism. It's the lived experience of racism that affects our health care. And then that also can contribute to a number of other things, such as access to health care, the quality of health care, the way that we experience health care. In fact, there was one study that showed that 40% of Black women do experience discrimination in healthcare settings. That can have an adverse impact on how we experience healthcare, how our families experience healthcare. We think of other things such as the environments that we live in, the places that we live, work, and play, and the exposures that Black women have in these environments, whether it's poor housing quality or air quality, heat, those types of things that can lead to adverse health outcomes.
What do you believe it would take to ultimately change some of the data and what you have been seeing even in your practice?
Sure. I think for a long time the emphasis has been on individual behaviors, but we have to recognize that at the end of the day, the underlying factor is racism, structural racism, the things that cause Black people in general to experience these adverse health outcomes. So we as a society have to recognize that these are the issues that underlie some of these health outcomes. But in the meantime, we can also do things as individuals to empower ourselves. So advocating for ourselves, having support systems at those prenatal visits or at our healthcare visits to advocate for us as well. And also recognizing some of the warning signs and taking them very seriously, paying attention to them to make sure that our healthcare providers are also paying attention to them as well.
Awesome. Thank you so much for being with us this morning. A lot of great information.
Thank you. Thank you for having me.